what process I follow. Let's see the video. Thank you so much for being here. In this video, I'm just going to tell you the exact dollar a day to try and see what's working and what's not working. It's a simple concept and it's not something that you are guessing. It's a framework you can apply yourself. You just need few pieces of content to be recorded and then use those concepts and see which creative is working and then double down that one. So I'm going to tell you the exact thing that I do. I will show you the each step and this is how we do the things. So if you are new here, welcome, and if you are following me through Instagram or LinkedIn, then you are very welcome. Thank you so much for taking the time. Let's jump into the slide. So that document is particularly for dental clinic owners. It can be used by dentists or other doctors as well, but due to I work with only clinic owners that are mainly in the dentistry, or further we can say the cosmetic dentistry, that sell veneers, Invisalign, and other full mouth restoration, smile makeover, these type of things. The concept is to make a point to go, not to do content and have no direction. So how you are going to get what's the right direction? Because in this era there is much noise, and from that noise you have to sort, you have to see, you have to do what works, right? So I'm going to show you these slides. In this slides I'm going to show you how to fill those empty chairs and be the name in your locality. People will know you, you will have the authority. And how you can do it, it's very easy. You can start. I will tell you guys. So the first thing here is that it's a weekly sprint, and what you are going to do, you don't you know do the creatives, and you try this and that and some, like, you don't do the guess. Okay, you have to do videos with who, how, and what, and you will test it dollar a day, 7 day. What you are going to do, you are going to make short clips, 15 to 60 second around. Okay, and the with different angles, with different creatives. That could be the smile reveal, something that people don't know, the anxiety. People are anxious before visiting those clinics, so you're just gonna be describing a patient. Just, you can say, you are just telling your patient, the patient is in front of you, and you are just telling how, what to do before the visit, and you are just telling the patient normally what you do. Just you are going to record different angles. Now you have recorded the different angles, and one thing here is that obviously you don't gonna get views, or you can say the open rate, viewer engagement, or what we say, the skip rate will be high. And obviously if you are on the Instagram, the major thing is to catch the hook within 3 seconds and don't have a bad escape rate. So what will do if you are doing like the 10 pieces or the 7 pieces, you are testing and testing and many will fail. The failure is not something that you don't have the skill. It's basically it's what the demand is not there. So out of 10, you will have one, two, three successful copies, and from those copies, you can see to put the budget on those creatives only. So what people usually do here is that they just spend the ad, spend media buying budget. They just spend and few creatives. They think that this is gonna work, this is gonna go viral, but it doesn't show the result. So they say that the ads don't really work. Only like Google Ads is working, but Google Ads is kind of expensive. So that's not the case. The thing is that you test and what creatives performing, then you double down those creatives. Okay, and then you optimize. And one thing is that while you are doing ads, you can do the boost. And the boost is like obviously not the exact boost. It's like the running the ad and running it only to play through, not the buttons or WhatsApp Messenger, because it will gonna cost you much high. So you are just going to optimize it for views. Don't do it for book now. It gonna cost you a much more than the views only, because the views only are cheap, and obviously you have that creative specific for your visit. So that's how you the algorithm it will decide, it will tell and show your creative to only those who are interested in, who has more likely they see 12-second videos, they have the engagement rate high, so they are interested in video views. Tell us this. And the next thing, it's always post natively, because the social media, these are platforms that they only has one thing. They want the attention. They want that people don't switch platforms. They are their loyals. So if you are on the YouTube, you can say, you will not say the Instagram and this. Maybe YouTube will not be that much, but even on the Instagram, you will not be posting for like other. Just upload the file and let the algorithm decide what to do. And the second thing, few people are having the clinic name and few are having their own name. So the best thing is you can do it by your own name, because it's gonna make you it's gonna make you more human. Okay, and it doesn't has to be someone else, because your face is there and the face is and the name must match. The rule number 6 is that you really don't need a polish high end ad, and that's one thing that people usually are not these days are spending more on the production side. The production side is good, and it's going to work, but uh, we don't have to spend it on the testing, because what happens when we are testing, that production takes a lot of time. So instead of we are doing the production and getting a month on the best creative. Why don't we waste time? We have to see what's working, and then once it is working, then we do it on the organic, like what we are doing on the branding, on the positioning. We do the production high quality on that, because the organic has to be like, you have to have that 3 second hook, and then something like the editing must be like this to be engaging. So that's obviously gonna help you. But on the ad, because what happens on the ad, people are seeing this and they really get it, like they are there to sell something, and they are, so when you are doing the unpolished thing, it looks like them. Okay, so they are going to watch it. It's like anything than normal day to day. So they think that what the dentist is doing, what it's saying, and it looks like only like normal video, but it's an ad. So they are likely to engage more. So now we have to, break after having the concept. Let's, wrap it. What other things, what are the angles we can do? Okay, so there we have done the 8 angles you can do. Many are already been done by clinic practices, which is good. You can see the before after of the smile makeover. You can see the something like this. There's a question, and you can do a Q&A, and you can answer the question. Just you can sit on there, and a team member of yours can just ask a question, captions on the screen, and can answer the question. Number third is why people are anxious. So you just show what the experience looks like when the patient visits, and how they are greeted by the front desk, and what they are given. Okay, you can do the room tour. You can do the routine, what you are doing, and then you can do the, let's say, you can do an introduction video of your hygiene, of your team, of yourself. The next thing you can do is what you do, like how you do the process, how you do the learning, and you can just add a few things. That's not something that, obviously, it's a creative thing. You can just tell the day, how today. You can also tell how the emergency cases are being handled mindfully, what the day looks like, and that's like basics. So here we have the first 7 days. You can split it into, the day one will be the film and setup. The After having the filmings ready, you can just add $1 a day and boost it without booking. Then you just leave. You don't really uh, change the things. You don't change the settings, because it's gonna take the time. The 7 days, algorithms gonna understand the video, and it's gonna show to those people that are likely relevant. And then you have you can see the engagement rate that's at 20%, 10% to 20%, and you pick the winner. And after the 7 days, you pick the winner and close others that are spending, that are those are not relevant to your likely media. And now you use that already worked, the data shows you that works, and then you repeat and then you scale. So this is how the simple it is, and few things to keep checking. Don't ever spend on the content that has not yet proven. Don't use the book now button because it's gonna charge premium. Don't paste links. Don't use logo. Use your face instead, and don't use like a polished version. Just be real and just try and test. Don't quit after seeing failures. You will have the winner copy already. You already have that copy already if you are working. So that's a video for how we do it. If you have any questions, you can ask me in the comments below. And yeah, see you later with another thing. Okay. So again, I would like to thank you so much for being here, because those videos are very much like long, like 30 minutes or 15 minutes. I'm sure these are valuable to your business, and if you have any questions, you can always ask me. The best, you can ask me on Instagram and the email. I've already told you. Okay. Until then, thank you so much for being here.